thank you all speakers, discussants and chairs. I think it has been a very interesting day where we have learned from our invited experts. Questions have been posed, and I'm rather sure that we will have new questions to be addressed tomorrow. But because we have many things that need to be done tomorrow. And just my reflections of today, I think that this morning started very inspiring by Anne Hende, who was inspiring to point out what matters for older adults, and that we need to start the work with preventing frailty and use integrated care as a model for this task, including digital solutions. And what I found was interesting was really that you pointed out that there are several places in Europe where we can learn and exchange knowledge on these different models. And Brendan McCormack, of course, his message was really this morning that we need to pay attention to the different words and the meaning. For example, this about patient and versus person. And what I think was very important this morning that is made was this about culture, that person-centered care can never be, or integrated care can never be task-driven. Person-centered care really builds on relations. So we really need to understand and also take thoughts about how do we create the culture of person-centeredness in our own workplaces, in our organizations, in our systems, even if it's in the region, in the municipality, or in the universities. We really need to work together how to create this culture, to nurture it. And I think in the first session when we discussed this about person-centered, it's so obvious that this has been going along for a long time. And Sarah, you presented your work from Gothenburg, and the person-centered care center in Gothenburg. You have been working more than 10 years and published so much. But you also can see that what we need to address when it comes to person-centered care is that, as some already have highlighted, as I think, is really about how prepared are we to work person-centered. And I think Annika on the screen and also Anna, you brought up this. Are the staff trained to meet questions from the persons, from the relatives, and so on? So my question there is really about how well are we training our students from different programs in healthcare, in medicine, in social care, and maybe in other programs too, because the training needs to be both theoretical to understand the underpinnings of person-centered care and integrated care, but maybe most important, the student needs to practice these skills. So what kind of clinical training are we offer them so they really can practice person-centered care and also integrated care? And also what kind of role models do we have for students in our daily work? And are patients and family members or the relative part of the team conferences? How are their voices heard in the hospital settings, for example? Regarding integrated care, I think this second session was really inspiring because we have understood that there are some obstacles here. But I thought it was so interesting to hear about Norrtälje 1000 and also from Eskilstuna that it is actually possible to make changes and also to implement different projects. And in Eskilstuna, it has also been now, it's not only a research project, it is now daily work, so to say. But what I think is the real lesson here is to realize that this takes time. And I think of Helena, she's maybe have, but in Norrtälje, that they already started 2004. And as I understand, Nicolin in Jönköping, you also have been working for many, many years. And the slogan there must be, never ever give up. That you. So, but of course, here it's important to think about, well, Of course, we have the funding, we have what are expected, both when it comes to research, care, and I think you highlighted very well that we need to look into, say, that we have two work tasks, both the daily work, but also our work to improve the care for tomorrow. So finally, in this session about national standards, I think we have learned a lot now about how this standardization, the standard committee and the national standards about person-centered care could be a tool to help us both in research and to implement and change practice. I can, to be honest, I was a little bit skeptical in the beginning when I read when we had this title about national standards, because, well, in one way you think, how could standards be joined with person-centered care and integrated care? But I think you did a very good job to clarify and showcase the possibilities. So I think really that what's our really task for tomorrow is to identify what enables the implementation of person-centered care and integrated care in different contexts, and also how to evaluate different intervention and model using these enablers and overcoming the barriers. But as we have discussed, it has to be done systematically for building knowledge. But of course, we have realized during this last discussion that it's not easy. But why should life always be easy when you have something to do tomorrow? So in this group with you, I really looking forward to continue the discussion and see how could we develop our care, because what we know, everybody will age and getting into the situation of being in need of support for our lives and so on. So this is something that is very important. So what I think is we have had a very interesting day, very learning opportunity today, and I really would like to thank you all for participating, both here in the room, and I hope we still have some people online. Thank you to you. And Amaia, next step. Will you tell us? Thank you so much. Yeah.
I think next step, at least for today, is to make a list of all of the people that we want to thank and to show our gratefulness for today. Of course, I want to start by all of the speakers, discussants, and chairs today. So if today we are able to make a small step, a small difference, it will be thanks to you all. So big, big thanks to each and all of you. Yeah, you can. And this symposium was possible thanks to a very nice working group. I think that we have truly worked in a patient or person-centered and integrated way. I want to thank Anne-Marie, I want to thank Janne, I want to thank Mariam Kirvalitse, and I want to thank Anne Lilias. I don't know where she is. But it's been a huge pleasure working with you, women. Thank you. Thanks to Maria Joang from the Aging Research Center. We ate, we drank, we had everything diligently served today, so a big thanks to her also. Laura Fratiglioni, who I hope is still following us online. She couldn't join us today, unfortunately, for personal reasons, but she was one of the minds and one of the big motivations behind today's symposium already 1 year ago when we started speaking about this. So thanks a lot, Laura. Yeah. Yes, the funders, as I said, Jim, Forte, it's also thanks to the funding that we're here today. And of course, thanks to all of you for attending in real life and through Zoom. I hope that you enjoyed. I hope that we reached your expectations and hope to see you soon. Thank you.
But just before we go, I would also like to say thank you to you, Amaia, for actually, I know you've had a lot of help, but someone needs to start the process. Someone needs to get the idea to gather us, and I think it's been a really, really nice day. So thank you, Amaia, for making this day happening.